we move on to the examination of the alimentary tract or the gastrointestinal system. It's most important three organs which are important to palpate rather than two organs pertaining directly to the gastrointestinal system, that is liver and the spleen. And we will do other examinations as well. But I would request you to read carefully the basic principles of examination of the gastrointestinal system in the form of inspection, palpation, percussion and auscultation, because that will also give you a lot of clue. Here I'm going to demonstrate how to palpate the liver, and in the text I have mentioned quite a few methods, but I'll here elicit only two methods. Now, the first method which is commonly used is that you use the right hand of your own, and the patient should be lying down as comfortably as possible. Ask him to relax the abdominal muscles. Some clinicians, they flex the knee a little bit, but some they don't. So I will do like that. Now you start with the, you always remember to move, the fingers should be straight and they should be moving at the metacarpophalangeal joint rather than at the interphalangeal joint, or rather than moving at the wrist joint. Okay. So we should place the flat the fingers of the hand at the lower at the right iliac fossa, and ask the patient to breathe deep breaths in and out. And you keep on pressing parallel to the subcostal margin and go up. When the patient breathes in, you press down and you feel for the border of the liver, and the most sensitive part is this side of the index finger. And then you move across and insinuating your fingers while the patient breathes in. Because when the patient breathes in, and you carry on the opposite side as well to feel for the left lobe of the liver. The other method is that you place both fingers of your both hands and start from the lower part of the abdomen parallel to the parallel to the right subcostal margin, and with the same maneuver you press your fingers down and ask the patient to take a deep breath in and out. When the patient takes a deep breath in, the viscerals are pushed down and the liver edge will touch the tips of your fingers. The other crude method is the hook method. In this, you face the patient's foot end, place both hands like that and make a hook of your fingers and ask the patient to take a deep breath, and then you place your hands on the lower part of the chest and make a hook of the fingers. When the patient breathes in, the edge of the liver will touch your fingers, but make sure you keep on looking at the patient's face so that you should not cause palpation of the spleen is another important aspect. In this case, you use the same principle, but you start from the right iliac fossa, keeping an eye on patient's face, and then you move across with your fingers across the umbilicus towards the left subcostal margin and feel for the tip of the spleen, and also, if it is enlarged, for the notch. If it's a little bit difficult, you can just push with your left hand the margin a little bit up, so that this by pushing it forwards from the back, you are able to feel for the splenic enlargement. If this is not possible, you ask the patient to tilt a little bit, and you can feel again, because when the patient tilts forward, the spleen, if it is enlarged, will fall forward and you will be able to feel it. But even if it is impossible, then you ask the patient to put his arm under his head. This will lift the left hemithorax upwards and the spleen may be more accessible. So these are the four methods to palpate the spleen. The command will be palpate for the kidneys. For kidney palpation for the right kidney, we place our left hand on the back of the right lumbar area in the right renal angle, and we place the fingers of our right hand just interiorly on the right renal angle, on the right renal area, just lateral to the right rectus, and we press these two hands together and ask the patient to take a deep breath. And when the patient takes a deep breath, we will be able to feel the lower pole of the right kidney. For the left kidney, you tuck in the left hand at the left renal area on the back. Place the three fingers of your right hand just lateral to the left rectus and parallel to the subcostal margin, and press these two hands together and ask the patient to take a deep breath, and you will be able to feel the lower pole of the left kidney. Examination for ascites. For this purpose, ask the patient if he has got any tenderness in the abdomen, and the patient should be lying quite comfortably in the bed. And then you go towards the foot end of the bed and see any fullness of the flanks. Come back and look the position of the umbilicus, and then you start percussing from the epigastrium down towards the umbilicus. When you reach the umbilicus, you just turn around like this and go towards the area of maximum dullness, and then ask the patient to turn to the opposite side for a few seconds. You have to wait, and then you percuss again, and you see that the dullness before has disappeared and now there is resonance. You can repeat this step on the opposite side as well. That will tell us that this patient's got shifting dullness. Why we wait for a few seconds is we are waiting not for the fluid to shift to the opposite side, but we are waiting for the bowel filled with air to move on this side so that they become. Perform ballotment. This is usually done in those organs which are bimanually palpated, and kidney is most important of them. For this purpose, on the right side, we tuck in our left hand behind the right angle, renal angle, and place our right hand, the fingertips, in front of the right renal area, and we press it down with the right hand and we push it up from the left hand, and we feel that something is striking, and that is the ballotment, because kidneys is a ballotable. On the left side, place the left hand underneath and the right hand fingertips just lateral to the left rectus muscle, and then we press it down with the right hand and we push it up from the left hand, and we feel that the fingertips of the right hand touch a firm structure which is kidney, and that's a ballotment. Engorged abdominal vein. Sometimes due to the diversion of the blood vessels on the abdomen are distended, and one of the examples is the caput medusae, which you see in portal hypertension, or when there is a vena cava obstruction. For this purpose, you choose a segment of a distended vessel which has no tributaries, and you should choose a segment of about 3 to 5 centimeter. What you do is you place two fingers side by side, index fingers of both hands, and with one finger you squeeze down the vein and you lift the upper finger up and see which direction the vein is filled again. Then again you put the finger here, squeeze it up and remove the lower finger to see which direction the blood is filled in, and that will tell us either confirm the abdominal veins which are engorged. Instead of two fingers, you can use two wooden spatulae, but make sure you don't scratch the patient's skin.